Would Marsha M raise their hands? All right, well, Marsha, you were recently recognized, or will be recognized, as our National Leadership Champion Award winner. I think what struck me was just one, your humble approach to the work, and one of the individuals that recognized you as our leadership champion, they said she's been pretty open and candid about she's just never experienced anything quite like this the last couple of years. And yet you've been just an absolute rock for the Good Samaritan Society Wakan community. And I just cannot thank you enough for your steadfast service.
When you experienced your injury, which sounded pretty tough and pretty devastating, you continued to want to work, and the society is just very lucky to have you. So thank you so much for everything you do.
So I nominated Marsha Moestchen for the Ever Forward Leadership Champion Award.
When we found out she was our national champion, I said, really, was there a doubt? Who stands against her? Nobody can.
She is a consummate leader. She doesn't know the meaning of the word, it's not my job. She's always available to take on new tasks.
Back when I was in 4th grade, we were supposed to lay down on this piece of paper and outline us, and then draw and color. And so I colored myself as a nurse.
To give 37 years into healthcare alone in nursing field, and then to be in a leadership role, I mean, it's physically exhausting on a day-to-day basis, but she comes back every morning, and you would have never known that there was an issue the day before.
Well, how you doing? Good. I like helping people. I do what I love. I do what God put me here to do. He guides me. He makes the decisions of what I was going to do, and he's my support.
She is all about making sure our residents have what they need every day.
When I come to work, I usually go out onto the wings, talk to the nurse, see what's going on. A lot of times they will have questions, they will tell me what's going on or want advice.
She's very good at coaching our up-and-coming nurses.
She can have those crucial conversations. And she's like, well, let me show you how. She's really good about showing somebody. She says, let me show you how.
Marsha's always the first one to look closely at what they're doing, find opportunities for them to improve.
And there's a lot of respect.
They always know they can go to Marsha and she's going to be there for them. And that goes beyond the Wakan building. I mean, currently, her and a couple of other nurse leaders here are supporting our Postville location.
And the staff love her.
She coordinates our MDSs.
It's a nursing assessment. I have to go visit the residents first, do an interview, and then I look at their care plan. Hi there.
From the baseline care planning and making sure our residents get what they need, all the way to the reimbursement end that nobody likes to talk about.
The financial part kind of lays on me a little bit for the assessments and knowing what's going on with the residents.
She's always there for us. She makes any appointments, she's making appointments and answers questions. And
so this care plan then goes to the nurses' aides and the nurses' computers so they know how to take care of our residents.
She likes doing the care plan. She likes the more connection with the residents and the residents' family.
She leads our infection prevention strategies.
COVID has really changed the way things are in the nursing homes. It's really hard for everybody.
She had a pretty horrendous accident.
My fall happened in January of 2021.
It was not a good day when we found out she was going to be out.
That was it. I never walked again for 3 months.
The remaining team members rally when things like that happen. That's just the way the culture is here.
By golly, she still insisted on working from home that whole time she was on convalescent leave.
3 weeks or 2 weeks after I fell, I started doing all the assessments and MDSs and care plans from home.
Sending emails, helping me organize things.
People ask me why I'm still working.
I can't imagine her being gone, and when she retires, I suspect they'll get a little bit of her still here anyway.
I'm not ready to retire yet. As long as my health is good and I don't fall down any more stairs, I plan to work a few more years yet.
She just has this, I don't even know, grace and humbleness and humility that is second to none. And her clinical skills are off the charts. You would never ask for a better nurse.
In everything she does, she's all about sharing God's love with her coworkers, the families that we support, and the residents that we are charged with caring for.
I love you. Love you.